But I'm going to go ahead and get started because I know the governor's on a tight schedule this afternoon. So I just want to say welcome. All of the task force members, Governor Reynolds, are on the screen and we can see them. And they're all here with bells on. And they're excited for the work we're going to do, and they're inspired by your commitment. So it's my great honor to introduce the governor of the great state of Iowa, who is so committed and so excited about this work. Governor Reynolds.
Everybody, and thank you. I would be on Zoom. I'm having trouble with connection. I'm down in Osceola today. And so one more reason why we have to invest in broadband in the state of Iowa. So we're going to get that done. But we're here today to talk about another really, really important issue for Iowans all across the state. And it is a great day. And I wanted to start by expressing my gratitude to each of you for committing your time and truly your expertise over the next 100 days to help us put a strategy in place to start to resolve the child care issues that are impacting, as you all know, too many families and businesses across the state. And this certainly isn't a new issue. This is something that, the state and local government, along with a number of nonprofits and community organizations, they've really all been working together, attempting to tackle this for several years. And of course, COVID didn't help the matters at all. And while, we've seen some good progress being made, and in large part it's due to many of you that are on the call today and are part of the task force, I think all of us know that we still have a lot of work left to do to address not only the immediate needs of Iowa's working parents, especially when it comes to affordability and accessibility, but we also need to put a long-term plan in place as well. I think probably you all know that the Economic Recovery Advisory Board identified childcare as truly the number one need, and I would say opportunity for economic growth as we continue to navigate our recovery from COVID-19. And I'm confident that this is the group to help get that done. And we're going to do that by developing a strategic plan that will leverage not only existing state and federal resources, but will leverage private sector funding as well. And we can build on the creative solutions that are already in place across the state, as well as identify, I think, new opportunities, and then establish metrics for measuring our progress and success. I also want to just say thank you to Emily Smith for her leadership in this effort, and each of you for bringing, again, your expertise and experience and unique perspectives to the table. So as we've witnessed, I think, over and over again this past year, when Iowans work together toward a common goal, there's just nothing that we can't achieve, and we get big things done. So I look forward to your updates on your work and joining you again soon to hear about the final recommendations. And in the meantime, thanks to everyone again who's participating. Thank you for putting the time in for a really important issue. And I wish you the very, very best. Thank you. Good luck.
Thank you so much, Governor Reynolds. We look forward to the work as well. And with that, we're going to move to introductions and remarks by our fearless chair, Emily Schmidt.
Thank you, Director Townsend, and thank you, Governor. I am honored to serve this task force as chair, and this past fall, the governor created the Economic Recovery Advisory Board, and as she stated just a little bit ago in our final recommendations, the board identified addressing childcare needs in the state as our number one priority to move Iowa forward as we recover from the pandemic. And Governor Reynolds, thank you for taking such swift action to form this task force. And I've felt a lot of passionate remarks from many Iowans since this announcement. And we're gonna form and get together to recommend solutions to this important challenge. Now, we know that this is a complex task, and as childcare touches the lives of nearly every Iowan, whether it is our own families, our friends, employees, or coworkers. So thank you all for agreeing to be a part of this task force and the time that you will dedicate over the next 100 days. Our deadline is July 14th, and thank you for the time, but also thank you in advance for helping provide recommendations to confront childcare needs across Iowa. And I will tell you, it will go by fast, but it will be a lot of work, but a lot of meaningful work. And we would all rather be in person for this meeting. And I'm not a conventional type of person. And so when we get groups together, I always like to get the group acclimated to the purpose and the team. And with 100 days and through Zoom, it's, we really got to hit the ground running. So if you think about if we walked into a daycare, what we might imagine ourselves doing. So we might all gather around and sit on one of those colorful daycare rugs that have those lines and boxes reminding each child to stay within the bounds of the box. And we've all seen those type of rugs. And instead, ironically, we're on Zoom and we're all really made to stay within our own box on Zoom now too. So I just wanted to start this off, and I thought I would create a small video to help push us and think outside of the box. So I wanted to share this with you. We will go around and do an introduction. We will start just going off of this slide. So Jennifer, if you want to get started, say your name, what town you're from, and the organization that you're representing. And we'll just go off. So Lisa, you'd be next, and so forth.
Awesome. Well, hello, everyone. I know a lot of you, so there's a lot of friendly faces on here and new friends. So I'm so thrilled about this. My name is Jennifer Banta, and I am with the Iowa City Area Business Partnership. I live here in Iowa City, but I'm from Waterloo. So hi, everyone.
Hello, I'm Lisa Gates. I'm the CEO at Friendship Village in Waterloo, long-term care, continuing care retirement community.
Hi, I'm Miranda Namey. I am the owner of Quality Beginnings in Cedar Rapids, Iowa, where I live, and I'm also the executive director of the Collins Aerospace Day Academy.
Good afternoon, everybody. I'm Dave Arns, live in Des Moines, and am a senior vice president with Wells Fargo Bank here in Des Moines.
Hello, my name is Philip Herman. I'm with the Highland Park Community Development Association out of Des Moines. We're on the north side of Des Moines, and we have the Precious Beginnings Children's Center.
Hello, I'm Mary Jansen. I'm with Iowa Child Care Resource Referral, and I am the regional director in Region 2 in Waterloo.
Good afternoon. I'm Dawn Oliver Wyand, the president and CEO at the Iowa Women's Foundation. The foundation is located in Coralville, and I live in North Liberty. I'm excited to be here. Thank you.
Good afternoon. I'm Diana Williams. I'm the director of the Ann W. Wickman Child Development Center here in Atlantic, Iowa. And we are owned and operated by the YMCA, Mission Valley Family YMCA. We have birth to 5 in our building, and welcome everyone.
Hi there, I'm Erica Fuentes, and I am the director of Stella Sanford Child Care. We're an AC accredited center that is in Sioux City, Iowa, and we're owned and operated by the Crittenton Center.
Good afternoon, everyone. Terry Caldwell Johnson, president and CEO in the Oak Ridge organization located in Des Moines, Iowa. As part of our organizational portfolio, we have Oak Academy, which is a nationally accredited level 5 rated center for children ages 6 weeks through pre-K. Looking forward to working with everyone.
Good afternoon, everyone. This is Mayor Roy Buell, Dubuque, Iowa. currently my 16th year as mayor, and childcare has been an issue for all of those 16 years. So I'm looking forward to coming up with some real solutions for our business and our workers. Thank you.
Mayor Steve Rimwald from Mount Pleasant, Iowa. We're in the process of building a daycare at the present time.
Josh, I saw you were on.
Could you not hear me?
Here we go.
All right. My name is Josh Larrabee. I'm the Executive Director for Fairfield Economic Development Association, and we've been working on childcare here in Fairfield for a few years.
Hello, my name is Jenna Ramsey, and I am the Community Development Director in Stanton, Iowa. I'm currently helping with the process of fundraising for a new $2.6 million daycare facility. And I am also blessed with a 1, 3, and 5, three children, 1, 3, and 5 that attend our local Stanton Child Resource Center that we're fundraising for. Thank you.
Hello, everyone. My name is Amy Bice, and I'm a home provider in Cherokee. I look forward to working with everyone as well.
Hi, my name is Raven Walker. I'm a QRS 5 child development home provider out of Council Bluffs, Iowa.
Hi, everyone. I'm Tessa Dinsdale. I'm an SBA USDA commercial lender with Lincoln Savings Bank down here in Des Moines and originally from Rhinebeck, Iowa. So looking forward to working with everyone.
And I don't believe Mayor Newgard is with us.
All right, well, thank you everybody for the great introductions. We have people all statewide, and we're very excited to get started. As you've all probably have read the proclamation and the executive order, we'll just go tight overview. This is the task force, the ones who just introduced themselves, and then we're going to be getting into working groups, which we'll be talking about later, and then we'll at the very end talk about our next dates for meetings. And you've been introduced to Director Townsend, and then throughout the rest of the presentation, you'll see some of the other members that have been working hard on the different presentations as well as research to help us move along these 100 days. We also have wonderful support from both Iowa Workforce Development and DHS. So we all should be doing the little reactions, clapping and saying thank you very much for the service support. Shelly, who has been emailing out, keeps us all organized and getting everything in line. So we'll be having that support throughout the 100 days. And we'll be getting more information on each of the agendas as we go on, but you'll be getting information and as we move forward. And then the impact of childcare for Iowa has started to be quantified. And when we talk about the topic of childcare, you sort of think of where do you start? Where do you start looking at the numbers? And we have so many people to thank for looking into these numbers and getting it quantified. And those figures are staggering once we start looking at it. $935 million annually in Iowa. That is a result of childcare, and it's combining lost tax revenue, absences, employee turnover. These are all things that you can, get the numbers for. Now you can see the figures of the percentages of parents leaving or missing work. We all can think of people that we know that this happens to, but when you put it together in the aggregate, it does have a large effect on Iowa. And that's something that, although when we're thinking about it, one here, one there, when you think of it as the large overall on how it affects Iowa, it's something that if we start moving with solutions, we can make a huge difference. And when you think about other people that they can go back for education or training because of our solutions, it's going to make a world of difference to people. And to fully support the needs of Iowans, we need to not only start from the ground up, but at the base of the family with childcare. And we're going to have a large effect, a ripple effect across Iowa. Then moving on, these are the numbers, and we're going to go over a lot of data today, everybody. So I know we have a lot of ranging backgrounds, and most of us, if you know many lawyers, people don't go into legal field for working with numbers. But you'll all have these numbers in the PowerPoint slides that lovely Shelley and everybody else compiles for us, and you'll have at your fingertips ahead of time. So we're trying to gloss over them through the presentation. Otherwise, we don't know if we'll make it the full 2 hours, but we'll go through them. But these are the numbers that really affects the families, the number of the dollars that working parents lose within the first 3 years, and then all the way up for the first 13 years, from families to businesses to taxpayers. So it all adds up. And that's something that we cannot lose sight on. And those dollars mean a lot. And through pandemic, we also saw just how far that stretch of dollars goes. And we really need to start thinking about how can we be leveraging the funds at our fingertips and the government to start addressing these needs. And then thinking of it as business terms, Governor Reynolds has been looking to the industry field to take an industry look at governmental concerns and issues. And so just think of it as a business, where does it stand? And when demand outweighs supply, usually in a business setting, that's a good thing. But in this setting, it is not. We have 350,000 childcare slots that we need. And 33% of childcare openings have been lost in the past 5 years. It's something that we need to start addressing. So this is where we're at. And then now we're going to be going into, Janae's going to be going into, okay, this is where we're at. What are the situations for daycares and programs that they need to be doing to be able to be a daycare and so forth? So Janae.
Thank you, Emily. My name is Janae Harvey, and I'm the Division Administrator over Adult, Children, and Family Services at DHS. And I want to just start by acknowledging and giving gratitude to my child care team and all the hard work that they've put into both this presentation and the work that they will be doing and the expertise they'll be offering to the various work groups. In terms of all of us coming to this conversation with varied backgrounds, we thought it would be very important just to name the 3 types of childcare in our state. We have licensed centers, which many of you, you can think about these businesses typically run them, many children on site. And this is our predominant type of provider in the state when you look at the number of children who are cared for in those licensed centers. And we have data around the number of children in each of these types of childcare in our state on the following slide. But we also have home-based childcare providers as well. And there are 2 different types of home-based childcare that's provided in our state. Those are child development homes and then child care homes. So child development homes are homes that care for more than 5 children. And any provider who is a child development home, they're required to become registered in our state. And therefore, licensing and regulation does apply. And DHS compliance staff make at least one unannounced monitoring visit to all the child development homes per year. So there is an increased level of oversight that comes with a child development home, and that is triggered based on the number of children they are caring for. You will notice in the child care home that those are limited to providers who are caring for 5 or fewer children. In Iowa, those settings, they are not required to register with the state, although they do have the option to do that. Many of you are probably familiar with our child care assistance provider agreements. So any of our child care homes who enter into those CCA provider agreements, means that they are then regulated for those minimum health and safety requirements that I mentioned previously. So what you can see on slide 8 is a data breakdown that shows the total number of child care setting providers in our state and the number of total spaces that each of those child care provider types offer up to families. So as I mentioned before, you can see on the right-hand side that by far the majority of children in Iowa are cared for in those DHS licensed centers. You can see over 128,000 children are cared for in the licensed child care centers. But you can also notice on the left-hand side that the majority of the providers are actually registered child development homes at over 2,500 of those registered CDHs around the state. So we do have a variety of options in Iowa that lend themselves to various levels of regulation and oversight depending on the number of children they're caring for and in what type of settings. So this slide really shows the child care expenses and the financial payout that families incur when they have to purchase child care. So there is a very significant financial burden to families when they have to pay out of pocket for child care. And you can see this in front of you, and we have this broken down along both two-parent households and a single parent household, and looking at the percentage of overall income that one could expect to pay in each of these scenarios. I would like this group to note that the federal benchmark on what is considered affordable is around 7% of a family's income. You can see, especially for our single parent headed households who are engaged in educational activities or entering the workforce, to have their children in a licensed child care center would potentially cost them around 41% of their income. So that is a very significant financial burden. So let me walk you through this visual that is up on your screen right now. And what we are showing you with this map is it's a county by county map. And let's start with the color. So the darkness of the county, so it goes from light to dark. The darker the county, the higher proportion of Iowa households of parents are in the labor force. So our darkest brown colored counties on this map, those are the ones that you would expect to have the greatest need just based on the parents who are working. The other figures that are on those counties, those X's and those various size circles, also then show the amount of need we have. So how many children are in need of childcare in those counties? So the bigger the circle, the greater the need. So what you could expect in those counties, again, that are the darkest colored combined with the biggest circles, that's where we can really start to identify where do we have the greatest amount of need in our state. So hopefully this visual, even though it takes a little bit of thinking through, helps us think through a geographically specific strategy that really supports families in both urban and rural settings. So I'm going to just briefly talk about the impact of the pandemic on our various child care providers. And I would be remiss not to just name our child care providers really did heroic work and continue to do heroic work throughout this pandemic. We knew that without them staying open, our economic infrastructure really falls apart. Not only our economic infrastructure, but our essential workforce, such as in the medical field. You can't show up at the ICU and take care of sick patients if you don't have a place to take your own kids. So it was really a call to action to all of our child care providers around the state to stay open and quickly reopen if they had to close. And DHS and the state really demonstrated our commitment to supporting them through this hardest time. So at our peak closure in the state, 65% of our licensed child care centers had closed. Fortunately, that was very temporary though. What we did early on in the pandemic is we received a substantial amount of financial assistance. Iowa received $32 million in COVID relief funding. And what we did strategically in order to support our child care providers throughout the state and of various sizes is we decided to provide monthly ongoing stipends to any provider who stayed open. So we really wanted to incentivize them to keep their doors open, keep on accepting children. But we also knew that there were some providers, especially when there were infectious outbreaks, they needed to close. That was the appropriate decision for them for health and well-being. So when they decided or needed to close, they would alert us, and we provided financial support to them in order to conduct the deep cleaning that needed to occur in order to recreate safety within their environments. We also waived for our CCA families, so our families who are working poor, we waived their requirements to provide co-pays that are typical and expected when you're receiving that child care assistance. So we waived those co-pays. And we also waived the requirement that limited the number of absent days that those kids who are going to the child care providers, that payment that could be issued on their behalf. Again, with COVID, we learned quite quickly that a child may need to stay home for 2 weeks. That could be their quarantine period. It was not fair and not okay for our child care providers to go without payment for those days, or feel like they had to disenroll kids because those kids were coming back. So we used that $32 million, we used all of it directly and in support of our child care providers and in support of our families who are receiving child care assistance.
So as Janae talked about, Iowa was very fortunate that we were able to keep so many daycare facilities open, but we know that the child care workforce itself, i.e. those people who are working in our facilities, is an issue that we want to address and we want to talk about as part of this group. So in Iowa, not surprising, we have the third lowest number of child care workers in states that surround or adjoin to Iowa. We wanted to show you. Now, part of that, obviously, Illinois and Minnesota have much higher population figures than we do, as does Wisconsin and Missouri. But Nebraska is probably pretty close to us, and South Dakota is a little bit lower. But this is the number of child care workers that we have in the state of Iowa. Next slide. One of the things that we talk about in Iowa when we talk about our workforce, our Iowa childcare workforce, is we talk about wages, because wages in Iowa for childcare workers are some of the lowest in the state and also in the country. As you can see, 69% of the childcare employment is within our social assistance industry and are self-employed, meaning most of those that are being counted are those that work from home or have an in-care or in-home facility. Next slide. Then we wanted to show you how much by state child care workers are making. So you can kind of see it's a little bit hard to read, and we are making these slides available to all of you so that when you, after the meeting, you'll be able to pull them up and see a little bit clearer. But you can see that Iowa is in the white, which are the lower end of the child care wage rate. Not surprising, you see the darker colors, which are the higher rates, are on the east and west coast, and then in the state of Colorado. Next slide. If we break that down and show you the mean wage in the state of Iowa, you can see that we rank lower than any of the surrounding states that we discussed previously. The average rate of pay in Iowa is a little over $10 an hour. Now that's an average, or that's the mean, excuse me. But still it's pretty low. When you think about minimum wage being $7.25, you think about most hiring like Come and Go, Casey's, Hy-Vee, they all started about $12 an hour. It's not surprising that we're having a difficult time filling all of our childcare slots. And so that's one thing that we want the group to talk about is what can we do to make it a more attractive field and also to increase the wages that are available to those individuals who choose to work in childcare, because that's key to, we can build all the childcare facilities we want, we can increase the number of providers all that we want, but if we don't have a workforce to support it, none of that's going to be of any value. So next slide. And the next slide is going to show you the number of openings or postings that we have currently in the state of Iowa. As you can see, primarily it's in the Des Moines area where we have our largest number of openings, but we also have openings throughout the state. And the way that we, these numbers are drawn from our iowaworks.gov website, which scrapes from a lot of other employer-based websites where jobs are posted. So it'll scrape from Indeed. It includes the employers who post with us directly, but then also any other job posting board in the state. So you can see we currently have an opening, almost 700 openings, especially in the metro area where we appear to be really in desperate need of workforce. Next slide.
All right, so I'm back and I wanted to talk just a little bit about some of the training requirements for the various levels of childcare we have in our state. So on the slide in front of you are the training requirements we have for our CDH or Child Development Homes. You can see that we have some requirements around mandatory child abuse, CPR, and some essential childcare pre-service series. Some of these requirements, the training must happen prior to the application being submitted, but there are a number of trainings and 24 hours listed on this slide for trainings that must occur even after the approval to open the CDH is given. So ongoing training is an expectation. Next slide. Here are also some of the training requirements of our child care homes, those that accept our child care assistance. So I want to be really clear, our child care homes that care for 5 or fewer children and do not register with the state, they don't accept child care assistance, those are unregulated child care homes. But those that accept child care assistance, we also have a number of trainings that we require of them. You can see that the reduced number of training hours in the ongoing category is down to 6 for our child care homes. Next slide. And we wanted to be sure that people were aware of how we give support to entities who are working to meet those requirements for those various trainings. So you can see on the left-hand side, we have a lot of approved trainings that we make available or give information to entities who are looking for those trainings out in their community. CCR&R plays a very prominent role in our state regarding communication and support for our child care providers. And a number of our trainings are also offered online, which I think is important whether we're in a pandemic or not in a pandemic. Some of that ease of taking trainings from wherever you are, we wanted to be sure that those were available.
Okay, and now we can move into the federal lending programs. And this is kind of from the banker perspective. Obviously, we're going to talk about many funding opportunities around the state, but this focuses clearly on when a bank can come in to hopefully complete the puzzle. The first program is the Community Facilities Program. In the banking world, we call it the CFP program with the USDA. And the main goal for the USDA is to invest in our rural communities. So these are those programs where we are looking at population and longer terms and making sure that we can provide funds at an affordable rate. The Community Facilities Program caters to nonprofit entities. And with these loans, we can actually go out to a 40-year term, which is extremely flexible and an awesome opportunity for our small businesses. And the population cutoff is 20,000. So those smaller communities are benefiting. And for the USDA programs, we require 15 to 20% cash into each. And that can be cash in the bank, that can be grant money, that can be all types of funding sources, but it's based on the appraised value of the facility or the building the childcare business is in. And if that isn't a good fit, we can also look at the business and industrial program with the USDA as well. This program caters to both nonprofit and for-profit entities, so we're not pigeonholed to that nonprofit business. But it's a similar terms, 40-year term we can go out to, and the population cutoff is 50,000, so that's open to a few more communities as well. Same deal as we look at 15 to 20% cash into that project based on appraised value. So for those childcare projects out there that actually have quite a few funding sources such as local donations and grants and things, we can look at those. We can look at those programs. So I'm working on a couple of projects right now at Lincoln Savings Bank, and they've both been SBA 7-day programs. So the difference with SBA is they look at for-profit entities, and we can go out on a 25-year term, which is still flexible compared to just a regular business loan at a bank. These programs are meant to create flexible payments. And there's no population rule here as well. We can go, metro, we can go rural, whichever works. And my favorite part of this program and why I've steered my customers there, 10% down payment is the requirement, which as a banker, I like to see the childcare facility have as much cash on hand as possible. I'd rather than put that towards their operating expenses and towards their ramp up expenses and feel better about that, and not feel like they have to put a bunch of cash into their project. That's a very high level of just a few programs we can do as bankers. We try to be as creative as we can. As all of you know, each childcare center, each business is different, and we try to kind of get creative and see what we can do to get the money in their hands. So.
So you probably have recently seen the press release that went out from Governor Reynolds regarding the announcement of the Child Care Challenge Fund. We were able to combine money that was available from the state through a general appropriation for Child Care Challenge with some DHS funds that Janae's going to talk about. The Child Care Challenge Fund, we got $1.2 million from the legislature last legislative session to spend this fiscal year, and it is available to cover costs that that may not be available through other granting opportunities. It will pay for infrastructure, purchasing land, design elements, and also just capital costs related to creation of major construction. This year, we also funded we had to fund the Employer Innovation Fund grants out of the Child Care Challenge Fund as well, so it's $1.2 million for both. But we spent $1 million of that 1.2 on our Child Care Challenge. The governor, in her condition of the state speech earlier this year, asked for an increase of $3 million to make that fund $4.2 million. So hopefully we would have sufficient funds then to provide even more capital investments in new facilities while still funding the Employer Innovation Fund grant, which has been used in the past to help train childcare providers. So two key fund programs that we have going on in the state right now.
Hi, everybody. My name's Chanel Wagler, and can we go back to the previous slide? Awesome, thanks. I'm just going to give a quick overview of Early Childhood Iowa local boards. They're part of our early childhood networking of different supports. And currently there are 38 local boards. It's a pretty unique legislation for Early Childhood Iowa. The 38 boards cover the entire state and have a required mix of all different perspectives on that board. And one of their required legislated responsibilities is to conduct a community needs assessment and create a community plan, not only for themselves, but for the entire community that has an awareness and an understanding of supporting young children, their families, and the programs that support those families and those children. So childcare fits right in. One of the funding stream, or one of the roles of the board then, is they actually fill gaps that are identified through that planning process. They receive funding both through two different legislated committees actually, and part of the appropriations comes through DHS and part through the Department of Ed. But all of the funding that those ECI areas boards receive can and is used to support childcare. So what I like to do when you're thinking of it in this context of partners and other funding sources is this is a great partner that's already in the community, thinking about young children, looking at who does what, and then helping identify where funds need to be prioritized. There are, one of the things that I really like is there are examples of community plans that show even what other partners are supporting. We also are now the ECI board for 3 years. The state board, now I'm talking about the state board, has a private-public partnership committee that has been focused on childcare for the last 3 years. And we also see and really try to share where those communities are already working with businesses to promote childcare. So we hope all of this work will help build upon those efforts.
Right. So I want to talk a little bit about the Investing in Iowa's Child Care Funding Program. So Director Townsend already mentioned that DHS and IWD collaborated in order to push out significant financial support to a number of applicants who are either looking to start new childcare centers, or were looking to expand them, or to enhance existing childcare locations. Maybe that meant upgrading their playground equipment or purchasing new appliances in order to better serve children who were there. One of the really exciting things, and would be important for this task force to think about, is there is significant federal dollars that we used initially to support those applicants, but we have significant amount of remaining funds that are still available to continue to provide that support to childcare providers. So again, those could be childcare providers who are enhancing existing their existing services they offer. It could be some of the cost of starting up a new childcare location may also be eligible for these funds. And the work group that is really delving more into the details around expanding the infrastructure of childcare will have that information available to them. But there will also be information up on the DHS website in the very, very near future to extend that application process. So please be aware of that.
Good afternoon, everyone. I'm Nicole Hansen with the Iowa Economic Development Authority, and I did just want to take a minute to mention the state of Iowa's Community Development Block Grant Community Facilities Program. The Iowa Economic Development Authority manages the state of Iowa's community development, or CDBG, allocation. And one of the programs that we fund with these dollars is our community facilities program. We have approximately $2.3 million available each year. And one of the eligible facilities that we're able to assist under this program are childcare facilities. Under this program, communities must apply for the funds, cities or counties, but they are able to apply for these block grant funds on behalf of a nonprofit childcare provider. And our dollars are typically used for infrastructure costs, construction cost of building a new facility or perhaps expanding an existing facility. And since 2018, we have actually, through the CDBG program, invested about $3.2 million into childcare facilities in 6 different communities.
Okay, next slide, we're going to talk a little bit about resources that are out there for families when we are looking at childcare. So this first line, you're going to see information from the Department of Human Services. So a great place to send families is to this website. They can see tools to find childcare. So remember the map that was created right after COVID hit our state. That was a great tool that we can send families to. We also have compliance reports and evaluations that are all listed on this site so families can view that. There's also some great information out there on tax credits for families. So when families contact our office, I know for referrals, we can send out this information along with their referral packet. Child Care Resource Referral, as we all know, has a parent referral line that is free to all families in the state, a great resource and great parent specialists that are waiting to take that information and take those calls. We also have an online tool that they can go to if they are looking on the weekend and need to start their search, and those links are listed here above. If you're also not familiar with our website, I invite you to go check it out, iowaccrr.org. It's a really great website and a great amount of resources for providers and families. So providers also have a lot of resources at their fingertips on that website, and that link is listed there. We often send communities that are planning childcare sites to that link just to get their process started and work alongside our consultants. And then also for DHS, there's just a lot of great information on licensure. So we tie a lot of those links together with both of our websites to help communities as they plan. In the next slide, I get to really, along with Lisa Gates, talk to you about some childcare projects that are happening across the state. We have 2 that we're going to talk about today briefly, but we could talk, I think, all day about both of these communities and what they're doing. Glidden Childcare Expansion is one of those projects that is when you look at a rural community really trying to do something to sustain their community. This group of people that came together have done an excellent job. The Little Wildcat Education Center will open in 2022. This board was formed with some community members who were all working parents and were taking their children outside of Glidden for childcare because there was no childcare in their town. They were also having community discussions and wanting to sustain and grow that community. There was families moving back to that small town just to start raising their family, and they knew they needed to take action. So at that point, around 2 years ago when this team formed, they were at 40, they had lost 48% of their childcare spaces in that county. So their county is Carroll, where they're located. They worked alongside the Iowa Women's Foundation on a solution, and together this group formed, and the school district became a quick partner, and land was donated, and a new center is tentatively planning to be built soon. So they're really, I could talk over and over about this project, but one of the cool things is that to date, this community has raised $1.4 million for their childcare center. They also are receiving CDBG funding. They received challenge grant dollars, and they have also received a grant from the city from a past citizen that gives money each year towards a community project, and childcare was selected. So overall, this community just really has collaborated, done well at growing their community. And today I asked the board president, I said, is there anything else you'd like me to share with the task force? And she said, I just want them to know that beginning, our childcare center will be from birth to school age, but we are really focused on that education center. So in starting that education at birth for those infants as well, because we feel that this is important. So we wish them, we are excited, and we hope that in the next few months they start construction. And then I have the great honor of introducing Lisa Gates from the Friendship Village. I was also involved with this project, but I'm going to let her tell her story on how Friendship Village opened a child care center in Waterloo.
I tell you, Mary, we couldn't have done it without you. As I indicated before, I work for a long-term care community, and back in 2003, I had the benefit of going through another long-term care community in Southern Iowa that had a child care center on site. And it just sparked something within me to try and bring the elderly in contact and close, frequent contact with youth. It's such a benefit for both demographics. But it wasn't until 2018 I had the support of my board to do this. My board chair happened to be the chair of Hawkeye Community College, who had made significant inroads into providing childcare. And our architect at the time happened to be working with Mary on state projects, or we would not have been able to get this project done without Mary. Frankly, I thought, what can be more regulated than long-term care? Well, it's childcare. I didn't know what we were getting into, but we built a new building across the street. The business model is open 24 hours a day, 365 days a year, with vacations, holidays being covered, et cetera, with an on-site sick bay. We opened in July of 2019, and we're making great progress. And then COVID hit and kind of has stalled us. So right now, while we have capacity for 105 children on site at a time, we have 50. We are not open every weekend, every other weekend. And right now we don't have anybody overnight. We did earlier on. We're anxious to see how things will progress now that COVID is coming under control. Our problem is the workforce, getting the workforce to handle the long waiting list we have to bring the children in. We started, my dream was to, my goal was to provide a high enough wage to attract the best of the best. So we started our childcare providers at $11 an hour and included healthcare, which I didn't realize was basically unheard of or happened very little in the childcare world. And that has not brought us the numbers that we had hoped for, nor the professionalism that we hoped for. So we're still struggling with that. And that could be COVID, who knows? So that's kind of our story. I'm very thankful to the community. We were able to obtain 3 grants of total of about $600,000 to help us on our way. But our board is so much behind this project that the community, the long-term care community, is supplying any shortages in operating expenses in the childcare. It's that important to our residents. They're the grandmas and the grandpas, and they missed our kids desperately while they couldn't see them during COVID. And our kids missed their grandparents too, and would send them letters and pictures. And it's just been a fantastic partnership, or experience, I should say, between the two demographics.
Thank you very much, Mary and Lisa. It's great to hear stories just like both of you had talked about, and getting together and listening to all of the, the good, the bad, and the opportunities that we have in front of us is exactly what this task force is for. So we look forward to the next, 99 days in front of us. We know that there's more stories out there, and we hope to create more stories that we can talk about in the future. So does anybody have any questions that they would like to ask? And if we get a popcorn of a bunch of them, don't hesitate to use the chat function either. Well, I will start with that there's a website that I put in the chat that you can find many other resources that we're going to be working with the task force on. So our goal at the end of this is to compile as many resources as we can in one place. And that starts with our website. So this website will, all of the data of the resources of the last couple slides that you saw, we're going to start putting that on the website so that when we funnel talking to other people, they can go to one website and find resources. So I'll just pretend you guys asked about the website and put that in the chat. And so you can share that with anybody that is looking for resources, as I did see some good chatter on the chat about, you know, finding out that there are resources out there. Oh, that's a
Emily,
good
this is Terry Caldwell Johnson. I appreciate the overview that we received from the staff. And I was just trying to seek a little more clarity on role, responsibility, and charge. So I always like to sort of start with the end in mind. And I know that we have identified some, I guess, subgroups or work groups or committees that will all be assigned to. And those are really broad. And there is, to me, a lot of latitude in what we could do, should do, must do, etc. Are there any limitations on how far, how broad, how wide we can go with our recommendations? Because I really feel like this is a prime opportunity for us to, you know, like go for the gusto and hit it way outside the ballpark. So I'm just trying to better understand sort of the framework in which we're operating, what limitations or latitude we have, just so that I can be centered on, you know, how bold and, you know, how brilliant I want to be in this space.
It's like you knew the PowerPoint slide, so we can put we can go through the 4 different working groups and go through the homework, and then we could touch on the Q&A after that, because that was a great lead into that. So there are 4 working groups, and we've all discussed a little bit about the topics of each. So the first one is the regulatory barriers and the financing options. In the chat, there was discussions of some good ones of the finding out of the new financing ideas there. So that is great that we paired that up. And then the second one is the, I know this is Janae's topic that she likes to talk about, is like understanding the childcare so-called cliff, and what is it a cliff? It is more of a gradual slide, and that's about expanding the eligibility for childcare assistance, and then the workforce issues of addressing the childcare workforce, recruitment, retention, reimbursement rates, and then the fourth one is increasing employer investment on that. And overall, the governor wants us to think bold, and that's why she formed this. She formed it swiftly. I probably have overused that word already, swiftly, but it's because she knows that it's important. And I think we can think as big as we can, because it is the #1 priority, and it's something that needs to be solved. And we actually have great funding available. So Janae, would you like to comment a little bit about that portion?
About the funding portion? Is that what you said?
Yeah, or any other topics that.
Well, so the only thing that I would basically want to echo to what Emily said is the urgency is clear. The first couple of slides of that PowerPoint to me are very striking in that there is a very real cost to Iowan families to do nothing here. That is maybe not easy to calculate, but there are a number of qualified entities who have put a dollar figure on that. If I recall correctly, slide 1 or 2 points to about $1 billion in what would be financial or economic investment in Iowa if we had the sufficient childcare. And that childcare, when we talk about sufficiency, we talk about it being high quality, accessible, and affordable. And those are really the 3 points of the triangle that we really need to be considering as these work groups come together. So going back to your question, Terry, I would say, let's be limited by our own mind. Let's not be limited by the existing financial situation. Let's not be limited by our legislators. Let's not be limited by code or rules. Let's think big, because it's our job to come up with the vision, and then we do the work to bring people along to see what we see. That's what I would say.
And then we can go to the next slide. Each working group is going to have a lead person designated. So for the regulatory barriers, we have David Aarons. And then for expanding eligibility and childcare assistance is Erica Fuentes. For the childcare workforce issues is Diana Williams. And then for increasing employment, investment, and engagement opportunities is Lisa Gates. Now, this does not mean that those are the only 4 leaders, because this is going to be a lot of work. Just like with the Economic Recovery Board, it was a lot of work, but it was the most rewarding for a voluntary board or committee that I've served on. So I think everybody's very passionate about this topic. So if anybody wants to volunteer that is on their working group to help the leader with taking notes or helping with agendas, please reach out to your leader. I'm sure they would gladly take some extra help. And then obviously these are the task force meetings that we are on right now, but working group members are always encouraged to come and attend the task force meetings as well. And then we're going to be working towards the final recommendations. And through this schedule, we have set these next meetings up. So we have the 100 days. So the first meetings that are up there are the task force meetings. So May 7th, June 2nd, June 24th, and July 14th are task force meetings. Those will be open to the public to attend as well. I know that we've had a lot of people that reach out on this topic, which is a great thing to have some backing and some excitement for. And you may see that keep coming as we keep moving forwards. We also set the first working group meetings for each working group. You'll see that also on this slide for April 7th and 8th. We did it at different times because there's multiple members that'll be on multiple working groups. And between Janae, Director Townsend, and myself, we're not sure if we're going to be able to make it to every work group between every task force meeting, but we're going to work hard to, whether it's divvy it out between all the 3 of us, but we're always going to strive to help and attend some of those working group meetings as well. And Terry, to your question of how big are we going to think, what are our bounds? And this is our homework, and that is king or queen for a day. So throughout this past year with COVID, we've had, Tiger King be popular. We've had, The Crown be, trending. So there's always been this, royalty trend. So now everybody can think about, if I had the crown, what would I do? And if you had a budget of, let's just estimate $390 million, just hypothetically from state and federal funds, what would you do with it? And Terry, like you said, what are there restrictions? Well, part of this board that the governor wants is to find out, yes, here are the bounds and what we might have to do with it. But if you could do what you wanted with it, what would you do? Because part of that might be recommending you should be able to do this with it. So let's find what the rules are and let's recommend some changes with it. So we do want you to think about not just, we appreciate asking that question because we always have to be mindful of that, but we also want to hear what you think should be done, because if we need to make any recommendations to change anything, we should be thinking about that as well.
Well, and Emily, if I could, one of the things that we did with the Future Ready Iowa Alliance was we took these big, bold ideas, if resources were not an issue, if you could do anything that's possible to do physically, what would that look like? And then we tried to break that down into more achievable aspects. But we want to start as big and bold as we possibly can, and then work our way to our strategic recommendations. And nothing's off the table. We want to take a look at all of the different options. One of the things that we wanted to provide as a result of all of your work, is kind of a pathway so that we can refer legislators to it, so the governor can review it when she's looking at what kind of legislation needs to be proposed and pursued in the next legislative session. But it's always a good idea also to be able to point legislators to these recommendations as well. And that way we could have more of a streamlined, consistent legislative agenda around childcare, because that's what happened with the Future Ready Iowa. Was they took the work that the Alliance had done, they created the Future Ready Iowa Act that passed unanimously the first year. The second year, the legislature came back and backed it up with infrastructure funding. That was also unanimous. And then in the third year, or the second year after funding, they started providing significant amounts of dollars, $13 million for the last dollar scholarship, 20 million last year, and hopefully 23 this year. So that's kind of why we want to be big and bold in our ideas, and also inclusive. So for those of you who are in the working groups who are attending this meeting, we want to say thank you for being willing to step up and help the task force members come up with these big, bold ideas. We recognize we couldn't have everybody with every area of expertise or experience in the childcare arena in Iowa on the task force, but that's why we wanted to expand membership to the working group. So if you know somebody that should be on a working group that you think the working group would really benefit from, let us know. We'll be happy to send out an invitation and invite them to participate in the purpose or in the work. And then our future meetings, we'll be talking about what the working group recommendations are, so that you can we can get feedback from them. We'll open it up to the public so we can get feedback from the public. We know just from the initial starts of the task force, we've gotten a lot of emails from people saying, what about this or that? And that's all great. And we've assigned that to the appropriate working groups, but we hope to get more of those. And we want to also give the public an opportunity to talk with us and share with us some issues and concerns that they have, so that they can, that we can be sure and address those as well. We're probably not going to get everything, but if we can at least have a discussion, that will help us formulate better plans. All right, any more discussions, questions, comments?
Director, will agendas and possible topics of discussion be sent out to the leaders of each of the discussion groups?
Yeah, as we talked about last week, Diana, we're going to send those out. We're going to send out a proposed draft agenda for all the working groups to start.
Okay, thank you.
I think we have some questions in our chat arena that we can take a look at.
All right, one question is that if we have ideas that we think could help, what would be the best way to share them? I would say that would be something we could have them email in. Should we have Shelley's email be pasted into the chat? And you could, if you want to email in Shelley, would that be the best way, Director?
That would be the best way, and then we can make sure I'll put her email in the chat for those. Although anybody in the working group and task force, you've probably already gotten a dozen or more emails from Shelley recently, but she can, if you can send them to her, then we will get them to the, Gov is GOV, not GOVE on that email address, but we'll get them to the right working group members.
And And then the discussion of not just building new centers, but what are causing them to close. So that might be some requests for a research item maybe. So that might be on the regulatory barriers and financing of if we have any data on why centers are closing. Now this past year might be skewed with COVID-19 pandemic, but if there's previous years of closing, data that we could maybe under, would that be under DHS, Janae? Data?
Just looking for more data.
For
Yeah.
why centers may be closing, yeah.
Yep.
And then why are we not addressing CCA reimbursement rates? And then I think there was a lot of chat back and forth on that. So that would be under the second work group talking about the child care cliff potentially, but would we also be talking about the reimbursement rates? I know we were talking about CCA funding, but I think that might be something that we could also address.
And there really isn't anything that there isn't anything that's not on the table. That's why we want you to give us your big, bold ideas and tell us that, make sure you talk about this and make sure you address it. So nothing's off the table right now. Part of it is just creating awareness around issues that we may not, know about. So we want to make sure that, if you know of something we need to talk about, please let us know. We'll make sure that we get that to the right working group to do that.
Erica, thank you for your response on that in the chat as well. Thank you.
This is Terry again. I had another quick question. So I know that there are other states in the country, even when you go back to the map that showed the median hourly wage that was being paid to staff in each of the states and where Iowa sort of ranks. And in addition to wages and other things associated with just workforce, are there other benchmarks that the state staff has evaluated to determine, all things being equal, sort of where do we want to be in this larger scheme of things? In other words, we know who's out there doing it really, really, really well, and we know that there are other places that are not there. But have we sort of determined in this broad continuum across, regulatory barriers, workforce issues, other ways to invest, if there's sort of that sweet spot where Iowa has determined they want to be? I think that would be really helpful, because if there are things that the staff is really interested in helping us to guide and help them to identify, that would be helpful to really sort of help us set some context so that maybe at the end of this process, we're all closer together as opposed to being farther apart.
I think in the Economic Recovery Advisory Board under Director Durham's work group with the economic work group, I think they talked a little bit about how they could address some small business workforce needs that maybe we could also, I would maybe have you look at that portion of the work group final report, because they might have some recommendations in there that we could also pair up with, and it not necessarily just be a child care task force issue, but just a small business issue as well. But that might be able to pair up nicely with that.
Emily and Director Townsend, this is Josh Larrabee from Fairfield. One of the things I'd like to see coming out of this, and I think you'd agree, is just a very strategic approach to addressing childcare. We have an incredible opportunity here for Iowa, in addition to some incredible funding. So just making sure we're strategic and looking at financially sustainable solutions for communities. And in addition to that, one thing I think that could be helpful to Iowa at large is when communities are looking at maybe partnering with state on some of these, that communities are working together. It hasn't happened here in Fairfield, but I've just heard in different communities where there's multiple projects maybe popping up. And I think it'd be healthy for Iowa overall if communities themselves were working together almost like on a strategic plan and then partnering with the state on whatever opportunities there are.
I will say that one of the really great things that Janae and I got to see recently when we reviewed so for the Child Care Challenge Fund, we received over almost 63 different applications for child care projects that are going on around the state. And we did see some small regional projects across multiple communities who were trying to figure out how to refurbish or rehabilitate a particular facility that would increase the slots. Lots of small town projects that were being worked across, with their economic development groups, with their local school, working with them, and with nonprofits that were in the area. So, I mean, I think that's a great idea, Josh, and I think that should definitely be part of our, recommendations is how can we not only address an Iowa strategic plan, but how can we also provide tools and resources to help regional groups come together to solve regional problems. So it looks like we're getting really good discussion in our chat box, which is good, some links, and we will copy all these, or we'll capture the chat and the links, Shelley, so that we can make sure that we can post those on if you haven't been to the Future Ready Iowa / Child Care Taskforce page, that's a page that we're going to continually update. It's a good page for you to use as a resource if somebody asks you, hey, what's your group doing? We've got the executive order on there, the press release. We're going to put the videos on there. I'm hoping, knock on wood, that I'm going to be able to show you one of the videos at the end of this meeting. But we'll also keep that as a repository for resources. And if you, as task force or working group members, have information that you would like to share, we can post that there as well. So we just kind of have a one-two or a one-stop resource center for people to refer to, or if you're not near your email, you can hop on that website and find whatever information you're looking for.
One question or just thought, concern that I hope we'll consider moving forward is that when I look at these sort of 4 categories of areas of interest, I start to see how they all become kind of interlinked, that why would I want businesses to invest in childcare to solve my workforce issues? And so I hope that, there will be a way for our various working groups to communicate and collaborate to address those areas of overlap.
Well, that's certainly what we hope the discussion in the task force meetings will be moving forward. That's why we'll have all of the working groups give kind of presentations about what work they're doing, kind of what priorities or recommendations they're looking at, so they can get feedback from other task force members and also do that cross-tab coordination and collaboration. I know in the Alliance, there were times when we actually would have working groups meet simultaneously or together when they discovered that they had multiple areas that they wanted to talk through, and kind of then assign, okay, this group is going to take this work and this group is going to take this issue, and then kind of a divide and conquer once they did that collaboration. And that's certainly something that'll be an option for these working groups as well.
Director Townsend and Emily, would it be okay if I asked Janae to comment on quality? Janae, one of the things you mentioned, in addition to affordability and accessibility is quality. Can you comment on addressing quality and regulation? I know that's something going through the funnel right now. There's a bill going through the state here. And can you just comment from a DHS perspective on any advisement to us on the committees for addressing quality when we're looking at regulation suggestions also?
Yeah, so I think the bill that you're talking about, or at least the only one that I'm tracking on, and there's a number of childcare bills this year, but the one that comes to mind when you ask your question is related to increasing the number of children who are able to be cared for in an unregulated and unregistered setting. So in meeting with legislators, what we really heard from them is altering code in that way is really designed to give greater flexibility, especially to rural areas. So there were a few legislators in predominantly rural districts who said the need is so acute that they felt comfortable in terms of balancing the need for childcare with really kind of pushing up around the limits of the number of kids who should or could be cared for in an unregulated setting. I believe where that bill currently is that it would increase the total number of kids in those settings by 1. So it increase it from 5 to 6 and still require those childcare homes not to be registered or regulated. So if you're thinking of a different bill, Joshua, go ahead and correct me, but I think that's what you're talking about.
Yeah, I'm familiar with it. And I'm from childcare professionals. I'll say on the state level, I've just heard different opinions on that, and if it's a good thing or not. And we're not here to, I guess, comment on that. I was looking for your professional comment on that from the DHS side. So I'm familiar.
Yeah, and we shared. It's a bill that I think warranted a lot of conversation, and we had those conversations with legislators in subcommittees, and we shared our concerns and our insights in other conversations with legislators. We thought it was really important to look to other states around Iowa to see what regulations they have in place, and that House file. It would definitely push us towards the upper bounds of any of the states in terms of the number of kids being unregulated. So, we just try and provide the background information, the policies and the insights around what other states are doing. Regarding your other question, I wondered if you might also be touching on a little bit of our quality rating system. We have something called QRS that is designed to really invite our child care providers to increase the quality of the types of service they're providing in their settings. And those QRS ratings are correlated with a higher reimbursement rate for CCA. So it is optional in terms of how far an entity would want to progress, but our highest QRS is 5. The rating is 5. And the reimbursement is at the 75th percentile for those providers who accept CCA. So we also have that in play as well.
Can I just say one quick fast example about quality as a childcare center? This is just how I say it in like regular folks terms. Like NACE accreditation is like that, the umbrella, and QRS rating is the actual things that help us build what those, the quality standards are. So, and same for QPPS. So like for a center, the more quality initiatives that you're joined in, the more quality things you get to put in place and practical reasons and ways to do that. So that's how I, like when I have to say to my financial people, which normally anybody with accounting can't stand me, but if I get to say to them, hey, we need to do this quality rating, and this is why, if you connect all those pieces and then it builds this, this thing that makes it all work together. So you can't really have one without the other. is kind of how I describe it to people. I don't know.
And translating those difficult, ratings and discussion and licensures and et cetera is key to building the partnerships with people outside of the childcare system to be able to have discussions like we have today and to move along bills and to move along policy, which is exactly what we're going to need to do at the end of these 100 days. So I liked that analogy. Well, I think we've had great discussion. Does anybody have any more? Let's see. Hi, Janine. DHS has worked with QRS oversight. Oh, working on a new QRIS system. Does anybody
has that been delayed though?
Yeah, sorry, this is Ryan. I'm with DHS. Yeah, the QRS system is going through a rewrite, and it was slightly delayed, but it's because we're building an IT system to support the work, so that does continue to move forward.
Is there any way to tie in QRS rating with tax breaks for parents who don't qualify for CCA or providers who don't have CCA families who are rated with QRS? I think that's something that in the homework that's a top topic for, it's definitely in the realm of can we do this?
Emily, Dave Arns, if Dave, you want to chime in, this is one of the topics we discussed in our private-public partnership to explore in Iowa. We have examples from other states, primarily Louisiana, who had a lot of success in that state with promoting quality, but also supporting like working parents and childcare providers for the tax incentives. And all of them were based on the QRS system and the participation. So it promoted quality. So we have information on that one as well.
Okay. Are we about done with questions for this particular meeting? I did want to recognize my fellow directors. We've had Debbie Durham as part of our group, so we appreciate her very much. And also Director Kelly Garcia, DHS is obviously instrumental and a big partner in these efforts. And so we wanted to give her an opportunity to make some remarks here.
Thanks, Beth. Really great dialogue today. I've enjoyed listening to y'all's conversation. I think, I really would absolutely kind of echo what Janae said and what Director Townsend said, which is, Terry, to your question, go really big. Definitely, we've got a lot of work around our CCA reimbursement rates. That happens within the agency anyway. I would go much bigger than that. It's one piece of the puzzle, but it's something we're already working on internally and really thinking about, a multi-prong approach beyond what state investment can happen from DHS, but really thinking about those private partnerships, tax incentives, all of the different structures that really do make a business float. To Emily's earlier point, think about this as a small business. Childcare is an area I'm certainly passionate about. On the DHS side of things, we're looking at it through the early childhood development lens and quality ratings, not only, but I'm a working parent. My children have been in daycare since they were 10 weeks of age. I'm still very much in the thick of being a daycare family. And in fact, my son is not in daycare for the first time in his life this year, with some flexibility on my husband's side from work from home. But I think to that end, we have had a lot of challenges this last year with COVID. As Janae mentioned in her opening remarks, our childcare providers have been phenomenal this last year. We've tried to be as flexible as possible and support folks in some unique partnerships this last year. There's certainly more work to be done there. I do want you to keep that in mind as you're doing this work. You know, we launched an interactive map in the beginning of our COVID response. And if you go on there today, and we could share the screen and show you, I imagine we're hovering around 10,000 open slots. So we've got a different issue in the state right now. And I'm not sure that any of us really know exactly how COVID has changed the work from home landscape. For example, Beth and Debbie and I met recently to talk about what our own structures are going to look like moving forward. And we're going to keep some form of flexibility. And I think that's important. I think a lot of employers are going to do that. So when childcare thinks about their business model, right? How do you not lose those parents permanently and create a more flexible space? So I think there's a lot to really think through here. I think, you know, the folks who have joined this dialogue are absolutely right for the task. And now it's your job to help us pave this path forward. I'm really excited about it. Our team is really excited about working on this. We've got a lot of ideas and a lot of research, I think, to help y'all do your work. So just thank you for having me here today. And we look forward to the dialogue moving forward. Thanks, Beth.
Thanks, Kelly. Emily, do you have anything else that you'd like to say? Otherwise, we're going to wrap. I do have one more video, and I've got it lined up and ready to go. I'm gonna take a risk and do it. But Emily, I'll give you the last word before I try to play it.
Just thank you again. We'll do great things within the next 100 days, and we're excited to work along with you. And we appreciate everybody's good time and the homework of King for a Day, King or Queen for a Day. We're excited to read all of those and, you know, put time and thinking on this. That's something that I can honestly tell you we will read every word or crayon colored paper that comes in because this is something that this is where we start from. So start big, throw it in, and anything else that you want to throw in with it, we're excited to read.
All right. Thanks, everybody.
Several community members in Mount Pleasant got together last fall and decided it was time to do something about a child care center because the community had been without one for several years.
I'm an in-home provider. I've been doing in-home for almost 5 years. It'll be 5 years this fall. And I'm the only option in Slater.
In Fort Dodge, there is a big gap between our existing child care pool and the need for child care to almost 3,000 spots at this point.
We have found out that there is a shortfall of over 350,000 slots all across the state of Iowa. In December alone, there were 140,000 jobs lost, all of them women. Now that's at the national level. If we need to grow our workforce and we want economically self-sufficient families, we need to get childcare back up and going.
The grant money will be used for renovations. It's going to cost over $300,000 to renovate the building. The good news is it's going to create 68 daycare slots. We have a 7,000 square foot building. And so we are going to have a kitchen. We're going to have a state-of-the-art ADA compliant bathroom, and we will have 6 classrooms.
We'll have 142 spots when my center opens, which will be huge for the community. My building will be in the middle of a new housing development, and it'll create a place that those families can stay permanently because their daycare center is right down the street.
We applied for the CDBG grant for Community Early Childhood Center and received that this past year. And what we're trying to do is expand their center for about 56 spots.
We were able to host 16 different training sessions. We had 157 people sign up because they were interested in becoming early childhood educators, either in home or in a center. 111 completed the training. We now have 37 who have become licensed in-home providers, and another 44 have completed their applications. What's even more exciting is the number of slots. When those 44 get their applications approved, we can see another 220 to 352 slots.
Childcare is a complex issue. The largest thing, in my personal opinion, is that we are serving for childcare assistance families that are at 145% of the federal poverty level and below. In a school setting, free and reduced lunch is at 185% of the federal poverty level. So there's a huge gap of people that we aren't serving.
Having these grant funding opportunities is a huge help, especially to for-profit businesses, because that hasn't been something that we've had the ability to access.
Somehow, you have to be able to pay folks a living wage to work in a daycare, and you have to make training accessible and available.
We need those federal dollars, those state dollars, business dollars, and philanthropic dollars.
Thank you to the state and the people who are involved right now in making this a priority and putting funding in place to help.